G'day HumeRidge, Coach Jess here and welcome to HumeRidge Health at Home Tips this week. I have a very special guest with us, Dr. Teresa Johnson. Dr. Teresa Johnson has been a GP for over a decade and now she actually supports other general practitioners in our area. So Teresa, welcome.
Thanks so much, Jess.
So first of all, with the restrictions lifting, does that mean we can get rid of some of those really high, hygiene habits that we've been doing recently with the COVID crisis?
Hey Jess, that's a really good question and it's one we've been hearing a fair bit. The short answer unfortunately is no, that now more than ever, being really vigilant with washing our hands and maintaining that physical distancing is so important. The restrictions have been lifted so that we can now see people face to face, but that's really on the proviso that we keep doing all those other things with hand washing and with keeping that physical distance, so that if inadvertently we were in the early stages of an illness, we still didn't spread that to the people that we love.
The other thing that's been happening is there's this COVID-19 beard pandemic happening. So all of our men have just decided to grow these massive beards. Now I've heard on the grapevine that beards are actually incredibly germy. So what is your verdict, Dr. Teresa Johnson? Should our men actually be shaving their beards for the health and safety of all of us, or can they keep them?
Now, I'll have to put a proviso, they didn't cover this in my medical degree. Look, I'd say guys, now this may be influenced by the fact that my husband have a beard and I might get in trouble if I say that they have to shave their beards, but no, look, keep those beards clean, and if you work in healthcare and you have to wear a mask, then you might have to get rid of your beard, but otherwise, you should be right to keep it.
Oh. My husband will be very happy. I'm not sure I'm as happy, but my husband will be happy. All right, the second question I have for you is it actually better to use hand wash like this, or can we use soap? Is one better than the other?
Look, Jess, soap has been around for decades and decades, and it is good old-fashioned soap and water works. It does what we need it to do, to kill the germs. And so, we've had over the last few years lots of different special antiseptics and antibacterial soaps and things like that. And look, at the end of the day, traditional soap does the job. And what's more important is that you do it properly. So you spend a good 20 seconds washing all the surfaces of your hands and make sure that you do it properly and you do it regularly. So wash your hands after you touch your face or before you touch your face, because that's where the germs can get into our system through our eyes, mouth and nose, and so that's really important. If we do inadvertently come in contact with any germs, not just COVID-19, for other flus and things that are going around, if we wash our hands, we're less likely to get the bug ourselves, but also less likely to pass it on to that next person as well.
Yeah, well this is great news because it's been really hard to get this soap on the shelves. Plenty of this soap, $1.90 for 4 of them, or $8 for this fella that gets left.
So we might even save some money in the process.
Save some money. It's good to know that this is just as good as that.